just like.
I was just listening to an advertisement for that on TV. I'd have to look up and see how it works. I know you don't have to have your blood tested, but I don't know its specific mechanism. I'd have to look it up, because I just heard the advertisement for it last night on TV. She was asking about a drug that is safer, apparently, than Coumadin for people who are on it for long periods of time. My brother-in-law has lupus, which is unusual for a male to have lupus. And he takes an anticoagulant. He takes a form of Coumadin. And so he's always getting his blood tested for bleeding times, or prothrombin times, PTTs they're sometimes called. And my father-in-law, when he was alive, was drinking red, purple grape juice. And most of you have heard red wine helps to keep blood from clotting. And grape juice has the same similar chemicals in it. And so he was visiting my brother-in-law, and my brother-in-law was having grape juice with his father-in-law every morning. And he went to get his blood tested, and he got a phone call, and then they were like, "Stop drinking alcohol." And he was like, "I don't drink alcohol." He goes, "Well, you're drinking something because your clotting times are too short. No, I'm sorry, too long." It was prolonging the time, and they thought he had been out drinking. He said, "I've been drinking grape juice." And they said, "Well, stop drinking grape juice, because you can't drink the grape juice and take your anticoagulation at the same time, because it's extending the time it takes for your blood to clot." All right, now remember yesterday when I drew the diagram of the capillary bed, and we had the arterial end and the venous end of our capillary bed. And we talked about the fact that hydrostatic pressure was higher at this end. And as we moved farther away from the heart and lost some fluid across the capillary bed, hydrostatic pressure became lower at the venous end of the capillary bed. And because of the presence of osmotic proteins, remember the name of the osmotic protein we looked at yesterday? Albumin. So osmotic pressure is lower at the arterial end. But because we lose some fluid, the albumin protein becomes higher in concentration. And so we gain osmotic pressure at the venous end, and we return some of this lost fluid back to the capillaries. But not all of it. So there is a net gain in fluid in the extracellular space around the capillaries. Well, over time, this results in edema if it's not taken care of. And so the purpose of our lymphatic vessels is to return this fluid to the heart. And we have lymphatic capillaries and lymphatics and larger lymphatic ducts. Well, you'll notice that along this vessel pathway, and there's no more lymphatic vessel names to learn. Okay, we're not going to look at a sequence of pathways of vessels. But along this pathway, the fluid, not that's passing through the lymphatics, goes through a collection of lymphocytes enclosed in a capsule known as a lymph node. Why do you think we do this? It's a filtering system. We have a high concentration. In Bio 430, you might remember the reticular fibers. And we had reticular tissue in the spleen, and the lymph node, and the tonsils, and it formed a network, mesh of entrapping and holding those lymphocytes. What would the purpose of that be? To send this fluid through a whole series of lymph nodes before we return it back to the heart.
Make sure no foreign pathogens.
Exactly, because remember, it's extracellular fluid. So if we have a break in the integrity of the oral mucosa, or the skin, or the digestive tract, or the reproductive tract, the tissue fluid may not be sterile. It's going to have pathogens in it. There might be some cancer somewhere where tumor cells have broken off. We don't want to just dump all this stuff back into the blood. And so it's kind of like sending it through a series of natural sand filters, if you have a pool in your backyard. And so before this extracellular fluid reaches the heart, it passes through a whole series of lymphocytes exposes any of the antigenic material in that fluid to the lymphocytes. Don't have to worry about the capsular structures here. So here's a diagram of lymphatic capillaries. We find the lymphatic capillaries in the same area where we find the blood capillaries, because that's where they're going to be picking up that fluid. And notice the blood capillaries are a closed system. So the other way around. Blood capillaries are open. They can go from one end to the other, and it's a continuous. Maybe continuous would be a better component. But they are closed in the sense that there's a very narrow gap between the simple squamous cells. In fact, our white blood cells don't leave the capillaries. Remember, they leave via the post-capillary venules. And so red blood cells are not going to be found in the interstitial fluid unless their blood vessel's been cut. But we can find white blood cells because of the post-capillary venules and the diapedesis that can occur, and that's how white blood cells get out here to function. So if we look at the capillaries, the lymphatic capillaries, this is a one-way system, and it's not continuous. And there are actually fibers, see if I have a better picture, that hold gaps open in the cells. Do I have one? Here we go. Down at the bottom. So there's little fibers attached to the outside of the cells, and as fluid pressure builds up in the extracellular space, this creates a gap. These cells actually separate and allows the fluid to move into the lymphatic capillary. And along with that, any cells that might be around. So extracellular fluid, bacteria, viruses, metastatic cancer cells if they're present, white blood cells, any lipid in the area, but not red blood cells. All right, because red blood cells should not be leaving. There's a belief they might be there, but they should not be leaving the tissue. So that tissue fluid helps to push it into those vessels, and then the vessels, under the same kind of skeletal muscle pump, all right, because they certainly don't have heart blood pressure pushing it, but they're going to flow along with the fluid in the veins back towards the heart. So, what structure, like veins, do you think these vessels have?
Say it again.
What structures would the lymphatic vessels have that veins also have?
Valves.
Valves. All right, so as we have the milking, the contraction, and pressure on these lymphatics from the muscle around them, it's going to help to push the fluid back to the heart. And the lower thoracic pressure, intrathoracic pressure helps as well. When we look at tissue cross-section, lymphatics and venules, you cannot tell them apart, okay? Because they have essentially the same muscle structure. Basically, all you can say, if it has red blood cells in it, it's not a lymphatic. If it's empty or it has just white blood cells in it, it may be a lymphatic. All right, but you can't say for sure because structure-wise, it's a simple squamous epithelium. It's one or two smooth muscle layers, but too large to be an arterial. Okay, an arterial is going to be smaller in diameter for those two muscle layers. So it's going to look like a vein as far as the vessel diameter size in relationship to the thickness of the wall. So we have these collecting vessels, and then they form trunks, and then they form ducts. So if we look at an image of this, and this is what the first image was that we started out with, was a diagram of those pathways, and we have a lymphatic model in lab. You don't need to know the names of the collecting vessels, not even the major trunks, though I have them listed up there, but I do want you to know the ducts. Okay? So if we look at this image here, all of the lymphatics of the lower limb, and the lymph nodes tend to be found in your joints and along major vessels. You can see a bunch of lymph nodes here following the iliacs, and then they collect lymphatic fluid from the digestive tract. So lower limbs, abdomen, the left side of the chest, the left side of the head, and the left arm all empty into a very thin vessel found between the azygos and hemiazygos, right here, just behind the esophagus, known as the thoracic duct. And it empties into the left brachiocephalic vein, actually into the subclavian vein, just between internal jugular and vertebral. So it comes around the back. It empties into just between internal and external where the vertebral is. So here's hemiazygous and azygous, and here's the thoracic duct. Now you'll notice on the right side, and I have no idea where the embryologic reasoning for this comes from, but the right upper extremity, right chest, neck, and side of the head empties into about a 3/4 inch right thoracic duct. So it's a total asymmetry. The same location, but on the right side. When I was teaching at the medical school, one of the faculty lecturing on this said there are, he called them 4, there's actually 5 birds in the thoracic cavity. There is the goose, zygoose. There is the hemiazygoose, you forgot the accessory. There is the thoracic duck, and there is the right lymphatic duct. So the medical students on their exams for gross anatomy, they had multiple choice, and then they had essays, and they could choose from a couple of essays. And they weren't supposed to be charts or tables. They were supposed to be written out, full sentence discussion of whatever the question was. I don't know where this guy is, but it was his second time to take gross anatomy. He failed it the first time. Medical school, once they get you in there, they try really, really hard to keep you there. Unlike dental school or other professional programs, they bend over backwards to keep helping you get restarted again. And so it was the second time through gross anatomy, and I was grading his essay, and he started out, in the thoracic cavity, there were 4 birds. I thought, no, there are no birds in the thoracic cavity. That was just an illustration to help you remember the names of the structures. It does, as long as you don't think that there's actually 4 birds. So this is where we finally have filtered fluid, and it is returned to the blood. So remember in the brain we had the sinuses receiving the CSF as a mechanism of getting that back to cardiovascular. So this is a way of returning the extracellular fluid. This has more clinical significance, a couple of things. If a woman, or occasionally a man, might have a mastectomy for breast cancer, in a radical mastectomy, they take out lymph nodes of the surrounding area, and so that interferes with the drainage of the lymphatic fluid back to the heart. And so they often have to sleep at night with the arm of the affected side elevated, because it can take over a year to redevelop associative lymphatics and go around the area where those lymph nodes have been removed. The breast develops as has a tail, essentially. That the tail of the breast tissue moves up toward the axilla, and that's one of the most common sites for breast tumors to form. So those axillary lymph nodes in a radical mastectomy are often the ones that are removed. And so swelling of the upper limb can be an extensive problem. Another problem that is not as common in the United States is a parasite that blocks the lymph drainage called elephantiasis. You may have seen images of individuals with elephant-sized lower limbs or a scrotum that's that big around because of the increase of extracellular fluid that's not able to return to the heart. Okay, we'll stop there. And we've gone 5 minutes. They must have changed the clock. It's always been 5 minutes slow. Now, well, what do you guys have?
It's 11.
Okay, well, sorry. It's always been right up to my desktop, but all of a sudden somebody fixed it.